Okay, so types of treatment, we've got different approaches as well as ideologies under psychotherapy. That we're going to go over the earliest form, which is psychoanalysis with Freud. We're also going to talk about play therapy, behavior therapy, cognitive, put it together, and a lot of individuals use this today as cognitive behavioral therapy, the humanistic approach to therapy, as well as biomedical therapies, including psychotropics, so medications that you take for the alleviation of mental difficulties. So psychotherapy, this is your usually your one-on-one or even in a group session where you are with a licensed counselor and you seek treatment for your mental difficulties. So your basic talk therapy, and under that, your counselor or your therapist will have a particular approach that they have. All right, and we'll go through some of those. The biomedical therapy, again, these are the medications or medical procedures to treat psychological disorders. We've talked about in previous chapters, one of the most common psychotropic or biomedical therapy approach used is an SSRI, or a selective serotonin reuptake inhibitor, which is used to alleviate symptoms of anxiety and or depression. So psychoanalysis. Psychoanalysis is one of the earliest forms of psychotherapy developed by Sigmund Freud. And what Freud did and how Freud went about this was through a process known as free association. So this is essentially just saying whatever comes to mind. And it's Freud's job, or the psychoanalyst's job, to make connections to the unconscious mind. And he thinks that whenever you bring what's unconscious to consciousness, that's at least the first step in alleviating that difficulty. Now, another thing that Freud tried to do was analyze your dreams. And although as we know now, we don't have an objective or unbiased way in which we can analyze your dreams, it didn't stop him from trying to interpret these underlying meanings of your dreams. Okay? Moving forward. So a lot of people, when they think of psychology, they think of this couch and lying down. And Freud did do this, where individuals, he thought that when you put individuals in a comfortable place where they're relaxed, they're more likely to share information about themselves rather than just a cold and sterile environment. They feel boxed in or just uncomfortable in general. However, in counseling today, you're likely not going to be lying on a couch. You're just going to be sitting next to the therapist or across from them in a chair. Play therapy. This is often used for children or individuals who may be on the spectrum, because expressing themselves and verbalizing what's going on can be or is difficult. They're not going to articulate themselves as clearly or as understandably as an adult would. So this is where play therapy comes into play, and most commonly what individuals will use is sand play or sand tray therapy, where children can set up a three-dimensional world using various figures and objects that correspond to their inner state. And this can happen a couple ways too, and if you just want to play house with the child or the individual, then you can set up a house situation and either have the individual do non-directive or directive play therapy. Now, non-directive play therapy are when children are just encouraged to play freely and either play things out at home, things like that. So you're just giving them different toys and they are to just play with them freely. Now, directive play therapy they will provide more structure. So such as, what happens at home, like what's the situation, and that will allow the child to give you more specifics on maybe what is going on at home or otherwise. Okay, behavior therapy. When it comes to behavior therapy, this is whenever we're changing undesirable behaviors into more constructive ones. Okay, and there are a number of ways in which we can employ this approach. Some people can use aversive conditioning. This has to be done very carefully. It uses an unpleasant stimulus to stop an undesirable behavior. So for individuals who have an addiction, especially, let's say specifically to alcohol, individuals can take what's known as antabuse. Antabuse is a substance that will induce vomiting and nausea when combined with alcohol. And so this is a way to aversively condition you to, whenever you see, smell, or taste alcohol, you will have a negative experience as a result of it, because you had that one instance where you either vomited or had uncontrollable nausea whenever you consumed the alcohol. All right. Exposure therapy. This is whenever we systematically reintroduce a once adversive or unpleasant stimulus and creating more control for your anxiety in the moment, or being able to get over that hump in general. Because we know that as far as anxiety goes, one way to continue to reinforce it is to avoid it. And if you're wanting to tackle that anxious stimulus or anxiety-provoking stimulus, then the best way to get through it, as long as it doesn't cause extreme is an extreme threat to your health or well-being, then we'll slowly expose that to you, because exposure is the best tool that we can use to treat like phobias and things like that. So for individuals who have a fear of public speaking, slowly introducing a crowd or slowly getting involved in public speaking will allow you to get through that anxiety, or at least make it more manageable. You may not be completely unanxious, but you can at least be able to manage it while you're doing it. All right. So another way that we can, this is a very elementary example, but it just goes to show how we can reintroduce an unpleasant stimulus. So Mary Cover Jones, she developed the first type of exposure therapy. So an unconditioned stimulus is presented over and over just after the presentation of the conditioned stimulus. So in this regard, the conditioned stimulus is a bunny. Let's say that we've got a fear of rabbits. Let's say we've got a fear of rabbits. All right. Now, an unconditioned stimulus that elicits a positive response with us is our favorite snack. So for Peter here, he loves cookies and milk. So let's say that one day we have a bunny in the corner of the room, and we have little Peter here enjoying his snack while the unpleasant conditioned stimulus is far away from them. And each day we move slower and slower toward the bunny, while trying to associate a pleasant experience with this once unpleasant object or thing. And so eventually, after 2 months, Peter was able to pet the rabbit while eating his snack. Cognitive therapy. This was developed by Aaron Beck in the 1960s. He was focused on changing unhealthy perspectives and unhealthy thoughts and putting them into more productive ones. Okay, so cognitive therapists help clients become aware of their cognitive distortions, because awareness is key here. And some examples of these cognitive difficulties or thought difficulties includes overgeneralization, taking a small situation and making it bigger than it needs to be; polarized thinking, which includes black and white thinking. I'm either perfect or a failure. This is common in individuals who experience depression, as well as jumping to conclusions, assuming that people are thinking negatively about you or reacting negatively to you without evidence. All right, so this is an example of very elementary example of assisting an individual through an unhealthy perspective that can lead to depression. So let's say an individual fails a test, and naturally they just say, well, I'm worthless and stupid. That's their internal belief. That's their cognition. So that leads to a more depressive outlook. But a cognitive therapist goal here would be, okay, we failed the test. Let's look at this in a different way. I'm smart, but I didn't study for this test. I can do better. There are ways to get around this and attack the problem head on. So that is a more positive and motivating outlook that does not lead to a state of depression. So we're simply taking the cognition here from an unhealthy one to a healthy outlook. Now let's put it together, cognitive behavioral therapy. So in this case, we're changing your unhealthy thoughts to more productive ones, while also changing unhealthy behaviors into more productive ones. So as a result of this works to change cognitive distortions and self-defeating behavior. Aims to change how people think and how they act. Okay. Humanistic therapy. This focuses on helping people achieve their potential. The goal is to increase self-awareness and acceptance through the focus on conscious thoughts. So again, humanistic therapists, they believe for the potential and good that's innate to humans, and that needs to just be facilitated out of them from the therapist. The therapist believes in this case that the individual is the master of their own life and that the solutions to their problems are within them. It just needs to be facilitated by the therapist. So a few techniques that are used in this, and created by Carl Rogers, by the way, is active listening, unconditional positive regard, as well as genuineness, empathy, and acceptance toward clients. So when it comes to active listening, this is actually being able to acknowledge what the individual is saying and restating it back to the person to clarify what the client is expressing. So this is a technique used so that individuals not only feel heard, but supported and accepted by their therapist by hearing back what they are saying. And it's just so that, and it's another reason to help both the client and the therapist being on the same page. When it comes to unconditional positive regard, the therapist does not judge the client and simply accepts them for who they are. So no matter where they've come from, no matter what they've done, the therapist's goal in this instance is to leave their biases as best they can at the door and meet the person for who they are, no matter what they've done and where they have been. Treat them as a person, okay? As well as genuineness, empathy, and acceptance toward the client. So in this case, we're expressing genuineness, like actually meaning and caring about the client while putting yourself in the shoes of the other person. It doesn't, for some people, it can be difficult to exercise empathy, but it is hugely important because if you just take a second to really listen to the backstory of an individual and hear about all the things, all the experiences, parental influences, etc., that have led them to making the decisions that they do, I'm not saying you have to agree with it, but you can at least be more understanding. And that is the goal of genuineness and empathy.